The VerifyNow system features a unique patented technology that provides clinicians with the only rapid and easy-to-use method to test for response to antiplatelet therapies in the hospital and physician office lab setting. Now, let us walk you through the technology behind the VerifyNow system. After the test device is inserted into the instrument, a whole blood sample collected from a patient dosed with an antiplatelet therapy is inserted into the round opening of the test device. This is called the sample well. This well contains a needle that aids in drawing the blood sample from the tube into the test device. No sample manipulation or processing is necessary. From here, the sample is aspirated into the staging well. The staging well heats the blood to 37 degrees Celsius. After heating, the staging well is pressurized, and the blood is pushed out of the staging well and into the 4 mixing chambers simultaneously. Contained in each of these chambers is a chrome-plated mixing ball and a pellet. The mixing ball mixes the samples while the test is running. The pellet contains fibrinogen-coated beads and an agonist that serves to activate the platelets and facilitate aggregation. As the heated sample comes into contact with the pellets in the individual mixing chambers, the pellets dissolve immediately. Simultaneously, the mixing ball starts to mix the solution. As the sample is mixing, platelets begin to activate and bind to the fibrinogen, creating aggregates. Inside the instrument, light shines through the individual mixing chambers. The instrument measures the amount of light transmitted through the patient's sample. As the blood platelets continue to aggregate, more light passes through the patient's sample. Over a period of a few minutes, the instrument measures the transmission profile of light passing through the blood sample as a function of time. On the left side of the screen is the sample of a patient who is responding adequately to his antiplatelet therapy. Because of this drug-induced inhibition of platelet activity, the sample forms fewer aggregates, allowing less light to pass through. On the right side of the screen is the sample of a patient who is not responding adequately to his antiplatelet medication. The drug does not sufficiently inhibit the platelets from activating, and as aggregation continues to build, the sample becomes clearer, allowing more light to pass through. Using a proprietary algorithm, the instrument analyzes the different light transmission waveforms and determines the patient's platelet activity and response to their antiplatelet therapy.